Hi, my name is Lily, Lily Wu. I'm a registered physiotherapist for the last 10 years. My background is I have a undergraduate BE Commerce, Bachelor of Commerce from UBC, from Sauder School of Business, graduated in 2008. And then I went to Queen's University in Ontario, Kingston, Ontario, for my Master's of Occupational Therapy. And then after that, I came back to UBC for my Master's of Physical Therapy, also known as physiotherapy. So that's my background, and how I came across my business idea was actually for the last 3 years, I had opened up my own private clinic. It's a multidisciplinary clinic. It's called Craft Clinic. So how I came up with the name was I was a big believer in being able to craft your own health. So our slogan is Empower Your Health, and the name of our clinic is called Healthcraft because I want to combine healthcare, which is a type of science, with art, craft. So you're merging art and science together, so there's creativity in being healthy or trying to empower your health by using creative ways. And how I'm going to do this with my business idea was actually I was treating a lot of patients who are healthcare practitioners, including family doctors, surgeons, nurses, licensed practical nurses, care aides, and I found a huge gap in them taking care of their own health versus their work. So they're not able to prioritize their health. And I started looking at the bigger picture when I see a lot of individuals, not just healthcare practitioners, who are not really prioritizing their health, when a lot of people tell us that their number one value is health, their own health, because when you don't have your own health, you can't work, you can't spend time with your family, you can't do all the things that you love, and I totally understand that. So for instance, one of my favorite older patients, he's 90 years old, he has a lot of health problems now. He used to be an engineer, and now he's telling me that when he was young, when he was youthful, he used his health to compensate, to earn his wealth, but now he's using all the wealth that he has accumulated over the years to pay for his health. And I'm a big believer in prevention and also to be able to take care of your health each and every single day. Because time is precious, we can never go back in time. Each day we get 24 hours a day, times that by 60 minutes per hour, and that's the finite amount of time we get. It's not like money where we can always get more money during the day by going to a bank or going to a lender. Time is something we cannot replace, and I want to capitalize on time and healthcare, which is why I'm here today to explain to you my business idea. So my business idea is actually having a mobile health truck that creates an environment for people to access health when they need it, instead of accessing it, after work, during their lunch hours. We're accessible on site in like different locations around the city that is able to provide a kind of comprehensive health services for these population. So for instance, I was thinking of acquiring 2 or 3 or 4, depending on the price of the used ambulances, and they're going to be decommissioned ambulances that the province is auctioning out. So for instance, I was looking through the website for the police, Vancouver Police Department, and they're decommissioning ambulances from 2009 to 2015 because they constantly get new fleets every year. So what we're going to do is use these used ambulances and put in other tools for physiotherapists. For massage therapy, they already have beds installed in them, so we just have to modify those beds, get firmer mattresses, or just replace those beds altogether. So they're foldable like beds, just like Murphy beds, but they're going to be like Murphy physio beds. And we're going to allow people to freely access our health truck services. For example, we can have these health trucks in popular SkyTrain stations. So when people are commuting in between work, they can stop in for an appointment and then go to work or go for lunch. Or we can place our ambulance strategically in various hospital parking lots where the ambulance can park, of course, in a regular spot, and doctors, nurses, patients who are discharged from the hospital, their family members who are concerned about their family members who are in the hospital, nurses, care aides, everyone have access to this mobile truck, which creates environment for various practitioners. So these practitioners are individuals I have worked with before, so they could include physiotherapists, massage therapists, osteopaths, acupuncturists, chiropractors, and then we can even expand that to personal trainers, yoga teachers, health coaches. So like the possibilities are limitless from kind of like this small idea of having a mobile health truck. And it's going to branch off our brand, which is Craft Clinic, just because crafting your own health, using creative ways to be able to empower your health. So I'm going to have physiotherapists, massage therapists, acupuncturists, yoga teachers, and chiropractors that can book our mobile truck, because I currently already have these staff working with me as contractors, as partners. So what we can do is provide an app. Currently we use a software called JNAP, where people can book different times using an online system. It's an online appointment and billing system. And we can incorporate this to creating an app that will be allowing people to see where we are located. Or we can just use Instagram or Twitter to let people know where we are that day, at what times, similar to what food trucks do. So I'm kind of building on an idea that food trucks everywhere around the world is so popular now, but people are so concerned about food. Like everyone calls themselves a foodie, but like everyone, their number one priority should be their health. Because without health, you can't eat whatever you want. You can't go out into the community to do all the things you love and to do sports, to spend time with your family, to be able to work and create an impact in the community. So what we're going to do is kind of follow a similar business model as food trucks and start off having our first ever health truck, not a food truck. That was a slip up. So our health truck, we can brand it as, like people will know it as the health truck, but we can also put our secondary logo, because in my clinic is Craft Clinic, which will be the parent company, and the food truck will be a subsidiary of our parent company. And we'll just call it the health truck so people know what that is. So how this works is over the next 6 to 12 months, I am going to present my business idea to various funders like Dragon's Den, to Women's Entrepreneur, the Entrepreneur Center, Enterprise Center, BDC, so Business Development of Canada, and various other potential funders to try to be able to secure more funding for being able to secure and recruit developers to build our app if we need it. That's kind of like later on, but our first and main goal is to acquire fleets. So our fleet will consist of used ambulances. As you saw earlier in the video, the used ambulances are usually decommissioned by each province and from the police. So there's the BC auction site, for example, in British Columbia, where we can actually go into an auction and look into the website and bid for specific items that the government is no longer using, such as used ambulances. I've also looked at Kijiji and Craigslist and other websites that are selling used ambulances, and they range anywhere between $4,000 to $10,000. So that's our first option, to look into different sources to get these mobile ambulances, which is already decommissioned. There's no longer the ambulance sign, but we could put our own logo on there. It's still healthcare. We could put our own mobile health logo that everyone recognizes universally as health. The next 6 to 12 months will be acquiring this fleet of 4 to 6 ambulances, getting my team who are currently working with me, these different healthcare practitioners, including myself, to be able to situate ourselves in various communities like hospital parking lots, underserved communities like the Gulf Islands, Sunshine Coast, Kamloops, parts of northern BC that is currently underserved, and we could start off using British Columbia as our prime basis, or we can go into like other rural areas in Ontario or the East Coast as well. So we can kind of have different branches throughout the different provinces. And my goal is to find a really, really strong team to be able to align. So I'm going to have myself as the business owner, and then underneath me will be different managers of different professions. So we're going to create and recruit for a manager for physiotherapists, a manager for massage therapists, a manager for chiropractors, a manager for acupuncturists, another manager for yoga teachers / personal trainers. So what each manager underneath me does is I'm going to have meetings with these managers, and they're going to go out to recruit for talent. So people like the managers for physios are going to recruit young or like aspiring physios who want to have the freedom of being mobile, because there's more flexibility. They can go into different communities. They're not stuck inside the confined walls of a clinic, and they can do something different, be able to make a difference, and be able to challenge the status quo, and just do something different and make a big impact in the community by not just staying within one clinic, but being able to help more and more people who actually require the services that we can provide, and the expertise, the education, as well as the training that we can provide for them. Yes, so for the next 6 to 12 months, I'm going to find strategic locations where we can park our health truck, as well as use that time to recruit for talented staff, like my middle line of the managers, who will be in turn trying to train and recruit for the level below them. So like for me, my job is to find a physio manager who is ambitious, who believes in our value, who's flexible, who's being able to adapt to the deadlines we need to be able to work within a startup company setting, and be able to find his or her own clientele or networks to be able to recruit more staff below her, and also to talk to doctors, talk to hospital staff, talk to underserved communities to figure out locations that requires a physio to be on site, as well as corporations like Lululemon, who's a big believer in exercise and healthcare, as well as like airline companies. So we can be situated in, let's say that's BC Cancer Society behind me. There is BC Cancer Agency, and there's Vancouver General Hospital in that bigger, taller gray building behind me. So we'll be situated and advertising to those bigger centers within each city, as well as we can be situated at airports. When people are getting off a flight or waiting for their flight, they can get access to a massage, which is covered by their benefits, especially if they're local, or even if they're not local, they can still access it. So it's just like how we have first aid everywhere. It's kind of having healthcare everywhere accessible. So like in sporting events, in like the NBA championships, in hockey games, we can be outside the arena if anyone needs. There's like the option to get a massage while waiting for the game. So it's just providing the opportunity for people to really reflect on their healthcare. And my next 6 to 12 months is writing business proposals to the various funders, and also trying to get submit my idea to Dragon's Den, to like CTV, to Global, just different like television stations, to different business competitions, Business Center, Business Development of Canada, accounting firms, overseas investors, local investors, developers. If you can think of anyone, it's kind of like even the health authorities, like Fraser Health Authority, Vancouver Coastal Health, and other such enterprises, including also like Small Business BC, on Women's Enterprise Center, Business Development of Canada, universities, UBC, SFU, University of British Columbia, Simon Fraser University. So different cities, City of Vancouver, City of Burnaby, City of Kamloops, City of Victoria, Parliament. So kind of like just getting the word out there and being able to branch and franchise, or branch this idea to more and more people. So that's our plan for the next 6 to 12 months. So the $100,000 that I'm hoping to win from this contest is going to be used to acquire these used ambulances. Each one is between, like I mentioned earlier, between as cheap as I could find. It's like anything from $2,000 to $10,000 just to acquire them. And we would need to make modifications to them. Pretty minor modifications, because ambulances, they already have all the medical equipment and the oxygen, the solar panels to have them full functional as ambulances before. So probably I'm estimating another $10,000 just to upgrade the whole fleet that we have. If we acquire, let's say, 5 used ambulances, then about $2,000 each to just maintain them, upgrade them, paint them with our branding, upgrade the interior to make sure there's a sink, because ambulances currently don't have sinks, so like we can install like a solar panel and like an internal sink inside, so there's hygiene and sanitary requirements that will be able to satisfy licensing and the different health authorities, their requirements for being able to provide healthcare mobilely. Additionally, as you can see, like the city is always on the go, like there's cars going everywhere, so the ambulance, our health truck, will gain a lot of marketing attention because it's going to be something different. It's not going to be a food truck. It's going to be called the health truck. So it's going to be on the road advertising as it drives from site to site. So there's kind of the residual advertising, as you may call it, that will come from just being around in the city. And right now I'm standing at a busy corridor called Cambia and Broadway, and there's one of our SkyTrain in Vancouver. This is one of a busier hub because there's a lot of people here transferring to the airport. So I want to make our services able to be accessible and known to the general public, to people who are in the city as well as people who are working in hospitals, having them spread the word. If we park at their parking lot, they can tell their patients, oh, when you get discharged from the hospital, you can just go to the health truck that's here today, and they can provide you with on-site physiotherapy inside their space. Or if it's a nice day, we can we can do exercises outside. We can have mats outside. We can make the outside community our health playground, as you may call it. Because growing up, when we were kids, we play outside. But as technology gets more and more prevalent, we no longer are spending enough time outside enjoying Mother Nature. So with the ambulance, like the personal trainers who are using our services, then they can be doing like boot camps. They can be doing personal training, physio exercise outside the ambulance, or we can be tying TRX suspension belts on different parts of the ambulance, on the doors, on the hinges, on the exterior, on the rack, to be able to provide exercises for everyone outside and inside the, our health truck, aka the ambulance, the used ambulance. So the $100,000 is also used to recruit for talent, like I mentioned earlier. So it's going to be recruiting for managers who will be paid a base salary, and then plus they get percentage of profit share, and all the physios, massage therapists, chiropractors, yoga teachers, personal trainers. Their incentive is to be able to earn a steady stream of patients, a caseload, stability. We're going to provide them with a salary, a competitive salary, as well as benefits. So that funding would go towards finding people who are motivated to believe in our values, our mission, and also motivated to work and be flexible. So if we send them up to Kamloops, they can, the ambulance, there's going to be beds that you can pull out. They can, 2 or 3 people can sleep in there. They can sleep up there. They can start working the next day. So our revenue generator is basically billing patients for that convenience, because we could still bill for direct billing for insurance companies such as Sun Life, Manulife, their workplace insurance, as well as MSP, with the medical services plan that the government provides for us, as well as ICBC, which is the auto plan insurance company in British Columbia, and other provinces may have different insurance companies for their car, and hospital have insurances for their staff. So it's being able to still bill insurance using our current system at Craft Clinic, since I have our home base in Vancouver and we have an existing clinic. So we will still be using our online booking and billing system, which is called JNAP, that we currently use, and we can use that to facilitate this operations of the company. And the practitioners themselves can be using, can access and use online JNAP wherever they are, using their phone, using their computer, laptop, and the ambulance itself will have an antenna that people can, our staff and patients can tap into Wi-Fi no matter where they are. So we can bill them and they can use Wi-Fi inside the ambulance if they feel like they need to check their emails, or if they need to check something, or our staff can do the billing using this mobile online software that we can book patients in, collect their payment, create a schedule. So yeah, some of our funding is to be used towards paying our monthly subscription for JNAP, which is approximately $100 per month, which is not expensive for about 10 or more practitioners. Yeah. So last point is I want to re-emphasize how my idea can impact the community. So number one, it allows accessibility to our services. Number two, it creates convenience, because time is precious. Time is money. We can't reverse the amount of time that we need. We can't actually increase the amount of time we have each day. Each day we get 24 hours and that's it. And a lot of people in the community, especially in the urban life these days, don't prioritize their time appropriately. So they end up, waking up, answering their emails, being on their phone, going to meetings. At the end of the day, they're tired. They can't schedule a meeting or an appointment in to see their physiotherapist, or to see a massage to de-stress, or go for exercises at the gym, or go to their personal trainers. So I want to actually relieve that pressure and that all the excuses that everyone has of not having enough time, not being able to find someone in the community for their needs. So I'm kind of creating that niche and that merge between being accessible, being convenient, being on demand. It's even better than a walk-in clinic because you get a mobile clinic, and kind of combining all the healthcare, allied health practitioners together in one spot where the community needs it, and be able to service these people. Third of all, I want to be able to serve the underserved communities, such as the First Nations, the indigenous community. We have a lot of that in British Columbia because we are inhibiting parts of the indigenous lands. And then also like people who are living in smaller towns, smaller cities, smaller communities that are hard to access to different healthcare, like physiotherapists. Like for the city of Sunshine Coast, or the island of Sunshine Coast in British Columbia here, it's the most amount of seniors per capita in the entire Canada. And that community only has one physiotherapist and a part-time massage therapist. So I feel like with our mobile health truck, we can be situated and sending our practitioners to those remote areas. And instead of having the requirement to find a place to live, they can live in the ambulance, such as people who do that all the time. Paramedics do that. Sometimes they need to take a nap. They take a nap in their ambulance during their off times, or during the times when they're waiting to see if there's going to be calls. Similar to nurses sleeping in the hospitals when they're on shift. Like our practitioners, if they need a place to stay and they don't have any, they don't want to be looking for a accommodation, short-term accommodation through Airbnb for, let's say, 2 or 3 days or a week, they could be sleeping in the ambulance, doing the pull-out beds, kind of like the Murphy beds. And it allows for kind of decreased costs, increased incentives for these staff members, as well as being, having them, venture out of their comfort zone and be able to live in different communities and actually see what it's like to, be outside this whole, the walls within the city and within the boundaries and the walls of their own comforted home or comfortable home. So in conclusion, I think this will make a big impact in our community, not just in the city where I grew up in Vancouver, since I was born and raised in Vancouver. I want to be able to start off using Vancouver as a prototype, or using British Columbia as a prototype, and be able to expand that to Alberta, to Ontario, to Quebec, even to the East Coast, like Prince Edward Island, where 6 months of the year they have snow, and they don't have a lot of these this type of access to healthcare like the rest of the other bigger cities. And then eventually I want to be able to push this idea into the United States, be able to push it into Asia, into New Zealand, into Australia, where our physios and our massage therapists can be at the beach, parking at the beach parking lot during the summer, and people who get hurt or people who want to just get a massage for like half an hour during their sunbathing sessions, they can, or they went surfing and they're sore right after. Or marathons, like Boston Marathon, if in Germany, if people are sore after, there's the health truck situated in a prime spot after the finish line where athletes can get the help that they need. As well as lastly, as a healthcare practitioner, we spend so much time and so much effort in taking care of other people, and we often neglect our own health. And in order to provide better quality care to our patients, I believe that we have to take care of our own health and take that really seriously. So in addition to serving the general public, I think there's a huge need to be able to service nurses and doctors, because they're very overworked as well, especially in the emergency room and surgeries. So we could be situated at various days of the week in hospital parking lots, in health centers, medical clinics, outside kind of heavy volumes of these major centers, and be able to provide our services to doctors, to nurses, to care aides, to volunteers, to patients who are being discharged. So in turn, we're creating a better beginning and a better future for healthcare in general and for our community. So thank you so much for listening. I hope you like my idea and how we can make a step forward to being able to create a better future for future generations, and really making that big statement of how much health means to us. Thank you.